I expect a few more folks to come on in, but in the interest of time, I'd like to get us started. So folks could take their seat. We do have a quorum, so I only know of 2 task force seats that will be empty today, so I'm expecting a few more folks to be here. Good afternoon. Thanks again for coming back to meeting 6. Here we go. Today we're going to really move out of discussion and into looking at solutions and start the move in that direction. There's a lot of stuff to go through. I want to take just a second and thank, in particular, the city staff who have been doing a ton of work to get us to this point today, as well as the folks that were serving on subcommittees that we will hear from today. Thank you very much. Deborah Wright, Wendy McClure, David Hall, not here, Brooklyn Holton back in City Hall, have just been working like mad with me to get these, some of the packet information that you have in front of you today. For folks in the audience, thank you again for coming. There are, again, comment cards in the back. The materials that we're going to be talking about, to the extent they're not up here in front of you, are going to be posted online. If not already, then probably within 24 hours. And with that, I'd like to just go around the table quickly with a round of introductions, and we'll start with Chris.
Okay. Chris Adams with Adams and Duncan Law Firm and the Everett Planning Commission.
Mark Niceather with CDOG.
Jim Upton, Evergreen Manor.
Alan Dorway, First Presbyterian Church of Everett.
Sofia Bertran, Lutheran Community Services Northwest.
Ed Peterson, Housing Hope.
Craig Scottall Real Estate, and the Downtown Everett Association.
Cassie Franklin, Cocoon House. Megan Dunn, Human Needs Committee.
Mark Manti, the Everett Clinic.
Bob Downey, Everett Fire.
Flora Diaz, Associate Attorney at Olo Nunn Law Group.
Matthew Savage, Journey Church.
Georgia D. McLeod, Council of Neighborhoods.
Renee Quistorf, Renee's.
Julie Zarn, Providence Regional Medical Center in Everett.
Ken Starks, Snohomish County Human Services.
Bob Dobler with Gamut 360 Holdings.
Dan Templeman, Everett Police Department.
Deborah Wright, City of Everett.
David Hall, City of Everett.
Okay, and I'm Karen Reed, the facilitator for the group. So today we are going to do 3 big things. The first is look at a problem statement, a draft problem statement. It's 1 page long and a little smidge. Want to get your feedback on that so that we can hopefully put some edits in it and maybe approve a problem statement at the next meeting. The second big thing we're going to do is take a look at the ballot that has all the ideas that are put on the table in these meetings by yourself or people from the city of Everett speaking to you. And then that homework has been supplemented by all the ideas that I got from the last round of homework. I think about 11 of you responded to that. It was not mandatory to respond. We already had like 47 ideas on the table. Now we have 92. So it's very exciting. And there will be some consolidation. And actually, I've seen much larger ballots, so don't freak out. We'll get through this, really. And so we're going to go through the ballot, talk about it, the voting instructions, the next steps. Then we're going to hear from our 3 task force subcommittees. And you will see if you've had an opportunity, their reports are both just like 2 pages long for each subcommittee. We're going to have quick presentations on what's in there. You can ask folks questions and just get clear on what the recommendations are. After today, all those recommendations are going to go into the ballots. We're going to remove duplicates, and then we'll send the ballot out to you early next week to be voted on. So that's the drill for today. With that, I'll turn it over to Chris.
Okay. I just have a couple of real quick remarks, and I'll keep these short. I want to just repeat what Karen said in terms of the thank yous. So behind the scenes, there's a ton of work being done, in particular on the ballot, getting things ready for our meetings. And the staff at the city, I think, has done a really great job in helping us work through this process. And I know there are a lot of things that are going to be on this ballot. There's a lot of items to talk about. This won't be our last time that we get to discuss these issues when we take this vote. But having more ideas on the ballot and the process that they've put together is going to help us facilitate the discussion. So I want to thank them in terms of the work. The other group are the subcommittees. The subcommittees, I think, have done a ton of work behind the scenes, and I think it's a really daunting task to ask them to come up with recommendations over the course of just one, or actually I think it's 2 or 3 meetings is what they did. I was on the emails of at least 2 of the subcommittees, and the work that they did to work on the language in terms of the proposals and the recommendations to come back to this task force, I think is really great work, and I appreciate what they've done, so thank you.
And I'll just also add that Chris and Sylvia have been fabulous as your co-chairs. We talk to them every week for at least an hour to try to make sure we're moving in the right direction and checking in with them. And we really appreciate your time and your input on that. So thank you. Okay, so we have very long meeting minutes in here, which are the next item it's to approve. It's right behind the agenda. If folks would like, I can give you a couple minutes to look at the minutes. Otherwise, I would entertain any amendments and at some point, hopefully, a motion to approve. So would you folks like a couple minutes to scan these? Would anybody like to move an amendment or correction? How about a motion to approve? Bless you, Georgia D. Can I have a second?
Second.
Thank you. All in favor? Aye. Yes. Opposed? The minutes are approved as submitted, and my thanks again to the city staff who take the first crack at developing these. It's a big job. They do a good job. Right behind the meeting minutes is item 5 on our agenda, the follow-up on panel information requests and other issues. So this is a list we've been keeping track of since the very beginning of the process. It's actually been in your packets every meeting, but we haven't always looked at it. This will sort of show you where we are responding to data. There's 2 new pieces of input on this document. It's items 10 and 11. We got a question coming in at the last meeting about how much of the county's human services money is expended within Everett and for what types of services, and you'll see a response from Ken Stark there in the column to the right under status, which is basically, it's very difficult to sort it out precisely geographically because their focus is county-wide. And then there was a question also at the last meeting about whether or not the number of park rangers in the city's budget has been decreased. And David tracked down the Parks Director, and the answer on that question is there. They're fully funded at the same level. They have an empty FTE position, is the gist of that answer. So that's where we are in information requests. Any questions for either Ken or David on those 2 items? Okay, we'll keep moving along. So on the 23rd, last week, Everett Gospel Mission had a focus group with a number of homeless individuals. There were, and you can see that right behind the blue page in your packet, there were approximately 40 homeless individuals that came and spent some time at the mission last Thursday evening, I believe it was. The 23rd? Yeah, 23rd. To share their thoughts and responses to a number of questions. And this is a transcript from that evening. And I know Mark was there, and I know Sylvia and John Hull are both out of town today at a meeting, so they can't be here. And there was a possibility, Julie was there as well. Would either of you like to share your thoughts about this? The transcript is fascinating. If you take 10 minutes and read it, it's very interesting. But I'll turn it over to you guys.
Sylvia prepped us well, so I think we both have a couple of comments. Sylvia did a great job moderating a well-attended focus group. And a couple takeaways that I'd like to share with all of you. The mission is really appreciated amongst those men that stay there, and they'll have well over 100 folks sleeping there at night. Pertinent to this task force, most of the folks have a very good appreciation for what's going on in the streets, and they don't really want to be there. But there's definitely some rules and culture, is the best way I could describe it, that are out there. And a number of folks really expressed their appreciation for law enforcement. It was very interesting. It's very dangerous out there is what's described, and law enforcement was appreciated for the most part. I was impressed with what they clearly described as a distinction between folks who were had really run into tough times, and the quote-unquote druggies. So we could talk about that a lot more, but you know, the men at the gospel mission were by and large folks that had fallen on pretty hard times. And Julie's much more qualified to talk about this than I am, but clearly mental illness was a major factor in what put a lot of folks that, you know, were at the mission and other folks that are on the street that weren't at the mission in that position. So I'm really glad we did this, and I urge you to read the transcript.
I too was very appreciative of the opportunity. I wrote some notes, and I agreed with everything that Mark mentioned, particularly the comment about the lack of consistent long-term outpatient mental health services and the contribution to the issue.
Can you pull your mic a little closer?
Sure. In addition, I'm just going to share some of my thoughts. I was impressed and touched that the homeless care about and find the same things to be important in their lives that I do. They want to belong and have friends. They don't want to be involved with drugs or alcohol, although some are. They're concerned about safety and theft. They do not like to be stereotyped or called names, and they're hurt by this. And some examples that they shared were that all homeless people are on drugs and that they're called bums or creeps. And they're profoundly hurt by those comments. They're concerned about jobs and goods that have gone overseas and the lack of local opportunities for employment. Many seemed quite intelligent and expressed an openness about being assisted to address challenges that hold them back: criminal record, difficulty finding employment. I heard a couple of folks talk about the benefit of being around people who bring positive programs to help develop skills like communication skills and job skills. Many or most of them express gratitude and thanks for the mission and law enforcement. And none want to be homeless. 100% of those in attendance said they would rather live in a house or apartment if they could. Barriers included rules and conditions that exist currently to do that.
It was really an impressive thing. I was amazed that they had as many people as they did participating in the discussion, to have 40 folks. And it's a really interesting write-up. Thank you guys both for going. Do other folks have comments or questions for Mark or Julie? I'm really glad we were able to do this, as you said, Julie. I think it's an important piece of the puzzle. So, okay, moving right along. The next thing on our agenda is item 7. That is the first of the big 3 discussion pieces for you, which is the draft problem statement. And this is just a draft. We really wanted to get your input on it. And so I think, unless everybody raises their hand and says, oh, I read this, I'm ready to go, I'd like to give people about 2-3 minutes to just go ahead and read this and think about it. This is sort of a way we would introduce what we sort of see as a situation that we're trying to tackle in a little more words. We want it to be concise. We want it to be understandable. And so I'm going to just take a couple minutes and I'll be quiet. Folks ready to maybe talk about this? Couple more seconds. We've been looking for the mysterious feedback for about a while now. It's a bowl of Rice Krispies somewhere near a microphone. We don't know. So if folks are ready. Again, we thought that using a bulleted format might allow us to communicate more using less words, but we'd like to know if stuff in here doesn't look accurate, or if there are gaps you have in here, or just what the heck is this all about. So I'll start with Georgia D.
I just have a typo question.
A typo, I'll take that.
6 lines from the bottom where
Uh-huh.
it says traditional criminal justice, it says while are appropriate for.
Oh, the
many."
R should come out, thank you.
The R should come out, yeah. Sorry.
Thank you. When you read this, did it look like the discussions we've been having? Were there some big issues we're not going to be able to get into absolutely everything that we've talked about, but if there are big issues that you think are important to understanding either the conditions out there on the street, the concerns that people have that arise out of those conditions, and the major obstacles to moving forward, we want to make sure we get the big ones on the table here. Go ahead, Cassie.
For me, it was just hard with the first point of street disorder and just that word street disorder. And probably in provider speak that says that, you know, it's like a disorder, a mental health disorder. What we're talking about is that the streets aren't, that there's behaviors that are challenging for people, or there's conduct that isn't appropriate for a business section, and so it's
Street conduct and behaviors?
Street conduct and behaviors that can be, because I think then that's what I've heard in this group is that people are perceiving a lack of safety and different things because of the conduct, and so it's the disorder of the street that's what we're talking about when it's messy and when there's garbage and things like that. That's something different, but everything that's here is talking about what some of our homeless and some of the criminal element.
So we could pull out there's some conduct stuff in here as well as some, there's the littering and the beverage containers and the needles. We could pull that out into a separate point, like.
And I can't think of the word right now. I'm just thinking of a word that maybe implies a little less judgment.
I think your point is well taken around the disorder, and maybe we'll pull out the other stuff that has to do with, physical stuff being left out and pull that in a separate bullet.
And as a side note, I think that, really at the root of what this is that we're experiencing the urban problems that every urban city experiences, but we're a smaller urban center than most urban centers are. And so that's kind of what makes the problem more unique in Everett as opposed to Seattle, because all this exists in Seattle, but it's different because it's such a big city. And so here we are, a small town, but we are the urban center for Snohomish County, so we have all the same urban challenges.
So we are experiencing problems common to other urban centers, but in a highly compact area that is also the county seat, and thus where many of those services are provided. Okay. That may be a good way of a good introductory type sentence. That's a good suggestion. Other thoughts, things missing, things that didn't ring true. Flora, thank you.
Sure. So underneath the constraints and obstacles, the first bullet point, insufficient funding and service capacity to provide the treatment, housing, and other services required. I think that with housing, from our discussions, it's really a two-prong issue. That there was a lack of low, affordable housing to prevent people from becoming homeless in the first place as sort of a long-term way to address people becoming homeless in the first place, and sort of the housing insecurity, the people who are not necessarily staying in a shelter, but they might be couch surfing and they might be living in their car. And I think that should be separated out from housing that might be considered reintegration housing or shelter housing. So I just want it to have its own separate bullet point for sort of long-term affordable housing planning.
I think that's a really good point. Good suggestion. So a lack of permanent affordable housing and a high level of housing insecurity in the city. I think we noted that over half the population of Everett is housing challenged, housing burdened by the national
Compared to their
definitions
income, the cost of rent. Yeah.
Right, paying over 30% of their income for rent or housing. So that's a good point. Megan. Thanks, Kat. Thanks, Flora.
On the third part, the constraints and obstacles.
Yeah.
The second bullet point says insufficient.
We'll take bulletproof.
It's kind of related, but it says insufficient policing staffing.
Mhm.
And could we change that to ineffective? Because we've identified some other opportunities for getting police involved in different ways with street level issues, foot patrols or bike patrols. So it may not necessarily be that we need more police, but doing different things.
Might be both. I'd hate to, don't want to sound overcritical of the police, but I mean, you guys have identified that you want to have different kind of strategies deployed than our currently, additional strategies, the need for additional strategies.
That item was specifically intended to reflect the concern or the belief that a number of people had that they would like to see more police presence in the commercial core areas, combined with the fact that we have 22 positions unfilled in the police department, so that it's literally a shortage of officers. All of their officers are very, very busy responding to 911 calls, and they can't right now with current resources. And again, correct me if I'm incorrect, yeah. Yeah.
24 vacant positions.
24, okay. Yeah, and so this was intended to reflect that reality.
But I think it's a good point that we can try to work in here, in addition to not having enough bodies on staff, because you can't get them trained up and hired, even though they have the budget capacity for them. You've observed that the lack of certain types of policing strategies may be a barrier to changing things on the street.
I just want to clarify one point, and this may have been brought up previously, but when speaking about the vacant police positions, you just need to make it clear that, and I think Karen, you kind of touched on it a little bit, that there is the funding capacity. It's not that we're not authorized to fill these positions. We've been getting pushed from city administration to aggressively fill these positions, but we're having a great difficulty finding people qualified that pass our background. So we've been implementing some new recruiting strategies and trying to increase some efficiencies in our background processing in order to ramp up our hiring. But even with that, we're still looking, if we hire an officer today, they won't even go to the academy until February or March of next year. And we have other retirements coming. So we'll continue to be as creative as we can in terms of the way we deploy our resources, but our first priority is the 911-driven calls for service.
Thanks, Dan. I know other communities struggle with this issue, but this was new information that you guys were also, that's a big number. So thanks for sharing that. That's really, I think, helpful context for there. I'm not sure who was first, Craig or Ed. You gentlemen can duke it out. Okay, go ahead, Craig.
Just a quick comment. The concern that visible street homelessness in the commercial core areas make those areas less attractive to shoppers and residents. I think you need to add the word visitors. We've heard a lot of feedback from like the Shack Art Center, the Kids Museum, that people visiting cultural attractions downtown also are concerned about it. And it also affects our ability to attract new business to those core areas, and prospective business owners would be visitors as well.
Okay, so adding the concept of tourism in the people being tourists, residents, and shoppers are being impacted.
And visitors.
Or visitors, how's that you'd like to say it? Visitors. Okay, sorry. And then also that this condition impacts the ability to attract new business to the downtown.
I would just lump that all under the word visitors. Keep it simple.
Just visitors. Visitors it is. Thank you. Ed.
I'm not sure if the dual concern of concern for the people that are on the streets and for the concern for those who are impacted by the people on the streets is coming through clearly here. Because I've heard a lot of people in the room say they really feel like we need to do better for the people that are on the streets, and that there are better opportunities that could be provided, and that it would, that is a value of our community, that we care about all of our citizens. So that, I think this is a lot of problem on the side of quality of life and our business community and public safety, but it doesn't really articulate the other side of the problem, which is how do we care for the people that are out there on the streets in better ways.
I think that's a really good point. So we've sort of mushed those two different concerns in that last bullet in the middle section there, and I think we could separate them out and have one that's focused very much on the concerns about the conditions of the experienced by the people who are on the street, and then have another one concerned about the impacts on the businesses and visitors and shopping and ability to attract folks downtown. That's a good point. We'll make that. That's a good add.
I have a second comment.
Okay, go ahead.
I also feel like the absence of a vision and the absence of an effective delivery system is a part of the problem. And that in order to address this issue, we need better vision and we need better system of taking advantage of the resources in our community in ways that are effective. It's a very piecemeal model that we have. Law enforcement addresses it from their vantage point. The business community responds from their vantage point. The social service system addresses it from their vantage point and within the funding constraints that they have. It's not really a system model that we have. It's a piecemeal model, and I'd say that's part of the problem statement here.
So that would be a constraint and obstacle, would be two things: a lack of vision and a lack of a more integrated, less fragmented, less siloed system for delivering services. Is that sort of it? Okay. Good. Thank you. Ken.
Also under constraints and obstacles, to try to put a couple of things in there that weren't listed there that I think would give it a little more balance. And that is governmental restrictions that make it difficult in siting affordable housing or services, or that drive costs up. And then another one would be fears of neighborhoods, businesses, and communities of siting housing or services in certain areas. And that gets to the NIMBY issue, the not in my backyard.
So two in the third section there, government restrictions that make it difficult to site services and housing and drive costs of those efforts up, and community fears about the siting of these facilities in their proximity. Cassie, and then Megan.
I just wanted to build off what Ed said, because I think it was really good, and I think that separating those two goals right at the beginning, rather than down below, but like right under the first statement, before we get into things, and saying there's, the two issues we have are the health and well-being of some of our community members, and the health and well-being of having a vibrant, economic, and safe community. So that those two goals, and I don't know how that would work, but that they somehow rise to the top, so that we see that we're trying to solve a couple different things and support the community. And I agree also with that vision statement. It feels like it's like a vision statement. We have a problem statement, and so that just rang really true to me, but we don't have a vision statement of what we want it to look like.
All we have for a vision is a vibrant and healthy community.
Yeah. So maybe just making that this is what we want. Here's the just the clarity around it.
I like that. Okay, that's good. So we may see those things both up at the top, and then as the concern, as well as part of the concern statement. Good. Megan.
Yeah, I was going to suggest something similar, where the concern for individuals experiencing homelessness is right up front. But I'll take the chance, since I have the mic, to also add a social issue of concern is lack of economic opportunity in the city.
So Okay, that's a third section. Other thoughts, gaps, improvements? Bob?
It's been talked about a number of times, but I didn't notice in here anything that described the fact that the street-level social issues, and this dovetails with what was mentioned recently, but they are a symptom of homelessness. And so it isn't just a condition that you can easily do something about, and if we aren't careful, we're treating the symptom and not the problem.
So that to note, it's sort of at the end of the first part that these issues, these street-level issues, are at least in large part, although perhaps not entirely, a symptom of homelessness.
Yes.
Good suggestions. Mark, you thinking anything there you want to share? Or?
The only comment I guess I would have would be under constraints, and the constraints issued is around the fact that Everett is the biggest city in the county and obviously the county seat, and therefore has the county jail, it has Compass Health, it has the Gospel Mission, all designed to serve the county, but they're all located in Everett. So as we've talked before, when people are brought to jail or brought to Compass Health, many times, not always when they're released, they're left here. And, it'd be ideal, like in the case of the Cocoon House, which originally started in Everett, now it has at least 2 facilities outside of Everett. So, if some of these organizations, whether it's Compass Health or Gospel Mission or others, could have satellite locations, obviously smaller, but in other places in the county, so Everett's not the only choice.
Okay, good. So we'll note the constraint around that, being the Everett being the county seat, and with the county jail, and many of the major service providers are, for the entire county, are located in downtown Everett.
So part of the issue is does Everett have to pay the price for the whole county's support, so to speak?
I'll say that's not a constraint. I think that's an observation. But the first part of that definitely is I think that's a really good add. Thank you. Anything else around that?
For now.
Okay. Other thoughts? Mark?
I guess I'm a little concerned about, I don't want to strike the word insufficient under constraints and obstacles, but I would want to add that we may have a misallocation of resources rather than insufficient.
Can you say a little more about that?
Well, I guess I get concerned that one of the things I've grown to appreciate here is that there's a lot of money that is going towards Band-Aids. And if they were applied in other areas, such as Housing First, we may be able to make some progress.
That helps a lot. Okay, I think I can get that in here now. The Rice Krispies are going strong. Sorry about that. Mark, is that your card still up, or is that just
sorry.
random? Okay. All right, this is really good input, and now you guys have given us some good direction. We'll turn this around, and it'll come back at the next meeting, and hopefully we will be able to sign off on a part of this document, which will be the first part of your ultimate task force report. So thanks very much. Really good feedback. Now we're moving on to the ballot. And so you guys got a copy of this very colorful document on your email last night. And for no apparent reason, it's printed in portrait rather than landscape, but there it is in your packet. This is not the final ballot, but it will, if we go through this together today, hopefully it'll be a lot simpler when it shows up for real in your email box next Tuesday or Wednesday. Okay, so can we put that thing up on the screen? You're working on it, sorry. Let's just look at the instructions in particular, make sure that everybody knows. All you guys are being asked to do here is to fill out the left-hand column rating. Put in a number 1, 2, 3, 4, or 5. If you try to put in anything else like 11 or 7 billion, it will not take the number. It won't take a 0 either. So you have 1 through 5, rate everything. You can rate everything a 5. You're saying they're all really stuff that should happen. You can rate them all a 1. You really oppose all of this, or anything in between. So that's basically your part of this. And what I want to do today is explain what all the rest of these columns are. So, ta-da, there it all is. This hopefully, about 80% of this should look really familiar. It's the ideas that were in the homework, plus that had already been submitted, and then the additional ideas that came back as a result of the homework are added in here. And all the columns from where it says short term, all the way over to the right, all of these columns were filled out by city staff as a sort of a preliminary assessment, so people get a sense of the magnitude of how you might tackle this problem. So the first one, hopefully it's pretty self-explanatory. This first column here is it a short-term or a long-term thing to implement this particular idea? Short-term, we arbitrarily defined as less than 2 years, long-term being longer than 2 years. So I'm just going to explain the ratings, and then we're going to just sort of scroll through. And the purpose of this particular discussion is to two things. Make sure you understand the instructions, and then if you have questions about what something means or you think there's an error that's really important in the way the staff have preliminarily assessed these ideas, get that on the table. So, and just before we go, there's lots of typos in this. It's still a draft. I think 1 or 2 issues from the homework actually got dropped. We'll put them back in. And then we're going to consolidate, and we're going to add all the recommendations from the subcommittee. So this is where the perfect should not be the enemy of the good type of thing would help today, since it was quite a scramble to get this to you by last night with the crew, and I appreciate their work. Okay, so the short-term, long-term, that should be pretty clear. Some of these things will be ongoing. Some of them you can get launched pretty quickly. Some of them will take longer than 2 years to do, and you'll see that for every item. I think there are like 90 items in this ballot at this stage of the game. Obviously, the next one, cost estimate. This is a real, what you would call a swag about how much would it really cost to do this thing. And you can see the ratings. $1 is less than $100,000. $2 signs is up to $500,000. 3 is between 500 and a million. $4 signs would be over $1 million. That's an arbitrary, really simple rating, but at least gives you a sense of the magnitude that, at least at the staff's best guess at this point, of what it might cost to implement these things. Required partners. We had first talked about whether we should designate who is going to be the lead, and the staff said, we don't necessarily think we should be the one to say who's the lead, and I think that's a perfectly fair observation. So they've identified 2 things. One, who definitely has to be involved, and the city, county, business community, and state, identified by numbers 1, 2, 3, or 4. And you may think something's missing or wrong there. We can correct that at any point in the next 3 meetings, but ideally if you see some big stop the presses issues, we should talk about that today. And then the last column, recommended partners. When you print out an Excel spreadsheet in a PDF format, you lose some stuff. So here's what's missing from that top column, right under recommended partners. Cocoon House is actually CH, for starters. So if you see a CH in that column, that means Cocoon House. If you just see an H, that means housing providers, generically. There's a couple that are missing, and I'll just mention those. You can scribble them down right now if you want. VA, you might see Veterans Administration. VOA, Volunteers of America. And HA, Housing Authority. So those are probably self-evident. You will be able to see this easily when you get this in a format that's actually a spreadsheet, but you can't see it on this sort of static document. If it says all, that means they're saying everybody should be a part of this one. Yeah, go for it.
Yeah, I just want to say one thing about the way this is organized. A couple of things. This could obviously have been organized in a lot of different ways, and maybe some of them would be more useful than what we kind of developed on the fly. But I would encourage you not to get hung up on the last couple columns, the required and recommended partners. That was really just a preliminary sense to help give you more of an understanding of what the idea involves. It's not in any way intended to commit anybody to anything. It has no effect other than to try to provide you with a little bit of information about the scope of participants that would be required to implement that idea. But unless somebody has real concerns about something, I would not waste a lot of time arguing over whether we have identified the correct, partners in each column. That really is not critical at this point.
Thanks. That's actually a reminder of something I wanted to say before I got launched this. You were convened as a citizen advisory group to identify recommendations back to the larger community about ways to address the street level social issues. So as I sort of see it, it's a very large group, so you have a lot of different ideas. It's important to get them all on the table and then really see what we can do to get the ball rolling as fast as possible, build some momentum and build in some accountability and follow-up to make sure that your recommendations don't disappear on a shelf somewhere. So I think there's actually a lot of value to the decision makers for seeing a large array of potential ideas on the table, and we will work from here forward to figure out where you have consensus and consolidate those into strategic themes and supporting tactics and stuff like that. But I think that the information about the range of ideas you considered, this is a really diverse group of folks at the table, and so you have a diverse set of opinions about what should happen. And that's an important fact that is displayed on this ballot that has a lot of ideas on it. So, if you had 3 people in a room, they might have a very different, much shorter list. They're having a party out there or something, aren't they? What is that? Is somebody's phone? Somebody's phone. Okay. But it is a lot of issues, and I think there's actually value in that, given that you're not an implementing group. You're not going to be putting any of these issues into action. We are handing this back to the community with some expectations that there will be some action and some follow-up. So we'll be talking about that action and follow-up expectation at the next meeting, but just a reminder about it's okay that there's a lot of stuff on the table at this point. I think it's actually helpful. Okay. Are there...
You have a question from a question.
Great.
I would just like to clarify, we are the mayor's task force. So my understanding is that we're handing this back not to the community, but to the mayor. And so my question to you is, once we do that, who in the administration is going to be responsible for implementing some of these ideas? It can't be delegated to people that don't have authority, and it can't be delegated to many people without accountability. It needs to be someone that has power and influence and can make things happen.
I completely agree with you with the amendment that the mission statement is both an expectation that is report back to the community, and the city won't necessarily be the one that can make everything in here happen. But your point about making sure that there is someone within City Hall with the ability to sort of drive this forward and meet the expectations of this task force to the best of their ability is well said, and something that is going to happen.
I think that's something that needs to be identified at the end of this group's deliberations. I think you owe it to these people for the time they've invested to do that.
Yes. And again, we will come back and talk more about how we would maybe propose that happen at the next meeting. Thank you for that, Craig. It's a really important observation. I don't like to ever leave town without this is what's going to happen next, and everybody knows, and there's expectations and accountability. So, yeah.
Yeah, I just want to clarify Craig's clarification. I would point out in the mission statement itself, I don't have it in front of me, but I believe it talks about actions by the community. So I don't want anyone to leave here with the misperception that what we're doing is creating a list, however long we want it to be, and that list will be taken by the city and will be done by the city. There will have to be discussion after this about which recommendations can be implemented by which entities. We may find that some of them can't be implemented. This is recommendations by the community to the community, including the city, for how the community believes we can solve these problems. So.
And that's one of the reasons, obviously, we have the sheriff and Ken and here at the table, and also the Housing Authority, because we see that it's not a one-man band in terms of pulling all this stuff off. But it's good. It's important that there is somebody within City Hall that's on point as we move forward to find those partners and make sure the communication and action is moving ahead. Okay, so if you looked at the homework, you'll see it's the same 6 categories of ideas, and you'll see new ideas here. And the numbering system, just to explain that, is A1 means it's the first. A is the alpha idea in category 1. So, and then in category 2, you start with idea A2 and roll forward. And then in category 3, we start with idea A3. So those identifiers are constant. No matter how we sort the table, you'll be able to track back to your ballot and say, oh yeah, that's where that was, and I can see how I voted on that. You'll be able to track back your own thoughts on each of these ideas, no matter how we sort this as we move forward. So, we're going to get into recommendations from all the subcommittees. You'll see a lot of these ideas are picked up by the subcommittees. So I would just offer that ideas A1 through G1 were ideas that were before the homework, and ideas H1 and I2 were added as part of the homework. I'm loving the typos on this first page. We will be fixing all of those. So the new ideas there were adjusting the release time from jail and encouraging more police officers to reside in Everett. Before I moved beyond that category, was there any just showstopper questions about stuff in this first category, or at this point people are like, I get what this idea is, I get it, I'm good? Mark?
Yeah, I have a question.
Yeah.
It was my understanding from a previous meeting that number A1 is actually something that is in process and will probably be implemented. Is that correct?
I think
I'll speak to that briefly. It is in process in the sense that the county executive has requested a capital budget dollar amount to do renovations to the building. We have the money to do the operations. What we're lacking is $1.6 million in renovations. So it's in the process in the sense that we've got political support with the county council, the county sheriff, the county executive, the city, and I are meeting and discussing. We hope to do a collaborative planning process, but we lack the capital funding to do the renovation at this point. Having it as a recommendation in this report would demonstrate community support for that project and would be helpful.
Okay, because part of my question would be are there other issues that are identified in this list that is something that might be in process now, and wouldn't it be beneficial for us to know that that's already something that's being considered?
Yes, I think it's a good point, and there are actually a couple of places in here, and in particular in the subcommittee reports, that you will see people saying, support the city efforts to, or support the county efforts. So this one in the final ballot will probably say, support the county's.
And if I could add one more, Mark, and it kind of gets back to some discussion that we just had a few minutes ago, and that is a project that we are working on with Burden Health Commission and Swedish Hospital Edmonds and others in South County is looking at expanding detox capacity in South County so that everything isn't located right here in Everett. And that has begun. There is a tentative site that has been identified, and that Evergreen Manor is working with folks in South County and actually going to be doing a tour of the detox program up here for some of the South County folks, hoping to keep that moving forward.
Right, I remember that discussion also, and that's why, like I said, I think it would be important to identify those areas that already have priority, or at least have some direction as far as moving forward. And like you said, if we support those, that's just all the better, I would think.
So we have in there, we'll make note as we are doing the final, support the county's current proposal, if that helps make it clear that it's out there.
And one more question, if I
Yeah,
could,
sure,
of the
of course.
police chief, specifically related to the bike patrols. I didn't really notice it until this meeting started, these meetings started, that the bike patrols, as far as I could tell, have gone away, and They used to be quite obvious a couple years ago, and I honestly can't recall seeing an officer on a bike this year. Now, is it basically just a staffing issue? It's not a money issue, like you said?
Well, our bicycle patrols have not gone away. We have, our normal staffing is 4 police officers assigned to the bicycle unit. Right now, we have 3, and one of them is part-time on a bike for that force, so it's about 3.5. I think what you're seeing, though, is that there is a draw for that service with those bicycle officers, not just in and near the transit center, but in throughout North Everett, and we're deploying those bicycle officers in those areas to address some of the issues that we've been discussing here. So when they've typically had more time to be able to devote to the transit center area, the mission area, what we've found is that the need to move those resources elsewhere has arisen, and we've responded by being flexible with that resource.
Okay.
Craig?
Just a quick question. How long have those vacancies been in place, at 24?
It's a number that fluctuates up and down, depending on our retirements. But we've been probably we've ranged, Craig, from, 15 to this 22 to 24 range for the last, year and a half to 2 years. But I will report that, this year we've hired, in 2013, we were able to hire 3 police officers who actually successfully completed our background process, and this year in 2014, we've hired 7 so far, and I'm confident by the end of the year we'll hire 3 to 4 more just this year, and we're going to continue to be aggressive into 2015.
Okay. So, let's see here. I'm supposed to figure out how to move this thing forward. That's sweet. Okay. So the category 2 stuff, more enhanced services, this is the biggest category. There's more recommendations in this category than any other one. I think there's a number of places where we'll be able to consolidate, like B2, C2, H2, and X2 can probably all be combined into one item. The homework ideas that are new that you might not have seen before, you wouldn't have seen before, begin at Y2. Some input around faith communities, engaging the homeless, shifting the deployment of the PATH folks. BB2 is, I think, related to the one-stop service center delivery that we talked about, maybe consolidating. That idea appears again and again. This is a really nice statement of it. CC2 is sort of another look at the church feeding programs, not assuming that the outcome should be a consolidation, but sort of proposing some thoughtful ways of looking at that issue, that we might want to consolidate those 2 ideas together around the feeding programs and see how people react to them or not. The BOSS model in Tacoma that we heard about, where there's a business outreach support specialist staff person, a couple of folks said that's something that I'd like to see us go after. So that's a new idea that's on the table now. And then some other folks, other thoughts here below. EE, reduce the concentration of services downtown. Support making it more possible for folks with mental health issues to get back into facilities. Prioritize support for kids under 18 and then young adults as opposed to older populations. You can see a combined service facility, which is sort of an interesting idea which hasn't been on the table before. So there's a lot of new ideas in this category. I want to just pause before we move to the next category and see if there are questions about anything that you see on here. Or hopefully the language is self-explanatory that you could rate these. Keep moving fast otherwise. Okay. I'm sorry. Yeah, Mark.
Quick question. And sometimes when we have suggestions about changing a city policy or something like, it'd help me if we made sure we understood any unintended consequences of that. So I don't know if there's room for a comment field here by staff, but.
We had a comment field, and they offered no comments, so I took it off. But we could expand on that one, the shift of policy. I mean, obviously, it's a sort of a zero-sum game. If you change policy without changing funding, it means funding levels, it means somebody's going to get less if you open up the policy priorities to new areas. So on that one, at least, that's sort of the drill. I don't know what else to say about that one.
I think you.
Yeah, I think when we get, at some point, there'd be an opportunity to kind of debate whether the items should remain ranked the way that they end up ranked from the voting process. And in that discussion, I would imagine that we can talk about unintended consequences. We have so many different perspectives here that there will be somebody who is able to spot or to explain what they see to be an unintended consequence. I think right now to go through and list unintended consequences of all items would not be really practical. So,
yeah, I understand.
Yeah.
Well said, thank you. So like on P2, I don't know where we are on that. No, that's back there. We could mention that the doubling of the detox bed capacity, that might shift to say support the county's ongoing effort to work with Evergreen Manor. Are you guys in partnership with Evergreen Manor on that? Establish a new detox facility in South County. So that's how that one might get revised there, apropos of Mark's earlier comment. Category 3, more housing and shelter. And we have a subcommittee around housing that you'll hear from today later. If anybody's, there were the new items on this list that you might not have seen, which you wouldn't have seen before, start at K3. Some of the wording. So K3, create city and county tax incentives for creation of affordable SRO housing. Though that idea and the ideas below that came out of the homework. Storage facilities for the homeless, offer services without barriers, the city doing that. More affordable housing, change city codes to provide private developer incentives to provide that housing. Prioritize access to subsidized housing for families with children, the disabled and elderly, which is not necessarily the population that we're worried about primarily on this in the commercial core, but it's a comment that was suggested. Sylvia, it's too bad she's not here. Move the gospel mission to a less central location, expand its capacity, and add second follow-on ideas, add service capacity around a halfway house with police staffing. And then don't expand offers with free rides. So that is, are there questions on items in category 3? We're going quick here, but I don't want to slow you down if you're good to go. Okay, category 4, improving public understanding. Really awkward widow here. Hopefully that will change. We just had, I think, 2 ideas. The last 2 ideas came as a result of the homework. So we had the business community liaison that probably will be merged with the boss idea. The new ideas are a hospitality program to facilitate a citywide philosophy of responsiveness and support to everyone, the whole community response. We may or may not want to combine that with some of the one-stop shopping stuff, but I think this is a slightly different tack. I don't know if the person who offered this would like to speak to it more to sort of share thoughts around that, but that was one idea, and then the last one had to do with legalization of marijuana. There's a nice typo there.
Yeah, the hospitality concept is one that embraces all of the different people that want to be a part of a solution. And I hear it from people that are frustrated. They don't know how to help the homeless, the street person, and want better help in knowing how to be helpful to business owners who need to monitor and control and interact in their workplaces to law enforcement who suggest that social workers would be helpful to them, to faith communities that want to find ways to be engaged in a part of the solution and a part of a system. And there are many levels of people in our community that want to be a part of it. And I think I put this forward because I think I want my city to be hospitable to all citizens. I kind of resonate with the Gates Foundation mantra that every life has value, and that a hospitality model in our city would be the way to do that. And people need help knowing how to be effective in a hospitable environment in our city.
So do you see this as closely related to the one-stop shopping for services, or do you see that those comments are more focused on the people who need help? This is more focused on the people that would like to provide help?
And in getting to know the street people, understanding their situations, helping them find a better place to be, helping all of us kind of understand how to manage the situation better. So professional outreach workers or social workers or the PATH program at Compass has an outreach component, integrating that into an education model and a support system for anybody that wants to be involved. It could be a convener of the faith communities that would come together and help the faith communities collectively figure out ways to work their magic in helping us address this issue.
So would the PATH one be, I'm sorry, I'm thinking about
Would be a
consolidate.
part of this
Would be a part of this, so
hospitality
maybe they
program.
consolidate with the PATH item. I'm just making a note of that. Okay, all right. Any other questions or comments on this category 4? Category 5, improving, it's not a hurricane, it's improving interagency coordination and communication. Those are pretty straightforward. The new ones are from items E5 and on. Analyze the impact from a systems perspective. Invite members from this task force to join the Snohomish County Partnership to End Homelessness. Create a subcommittee on chronic homelessness as part of that county partnership to end homelessness, to focus on the work and recommendations in part coming out of this group and just those issues. A systems model focusing on short-term and long-term issues and prioritizing them. I think this may come into how we would recommend the sort of the accountability and follow-up for your recommendations. This is where something like this is very helpful. The item I5 is actually a tag and should get merged with H5. Additional prioritized funding for people who are good collaboration, who do good collaboration with other agencies. I thought that was kind of creative. Focus on supporting nonprofits where you get the most bang for the buck. And I think that's it. Questions in that section or concerns? Yeah, Megan.
So A5 and the subcommittee, which is G5,
Yeah.
are really similar, to form a council to meet regularly to coordinate, streamline, and identify priorities. And then there's a subcommittee as part of the Snohomish County, so maybe they are different. But
One is creating a new committee and one is joining the other
joining the other
committee.
one, okay.
New committee versus join existing forum.
But I think
yeah.
this first one, A5, was around getting the service providers to come together to talk about,
To break down silos?
yes.
I'll put break down silos at the end of that.
Policy task force.
Okay.
Okay.
So then I5 could be included in A5.
Okay, thank you. That's actually helpful.
And D5 is also kind of saying the same thing.
Okay.
And so I5 was my suggestion to include the VA with it as a silo
Yeah.
to break down.
Right. And so that was part of H5, I think.
Well, A5.
It was part of A5?
A5.
Okay,
Yeah.
all right. Okay. Thank you for that. Other questions or comments on this section? We'll move forward. We're almost done with this. Category 6, the last category is advocacy. And the new items are, where does that go? New items are E6 and beyond. Advocacy around a campaign to give money to service providers rather than cash to panhandlers. Oh, there's the missing item. Change budget policies at the city. increase the minimum wage, focus on harm prevention, find it, fix it program to repair buildings, expand preschool, not necessarily a focus of the social street level issues. Case 6, countywide law and justice sales tax levy to expand chemical dependency. And I have to ask Ken, is this something that is on the books currently that just needs a vote? Or is this a new tax that is the idea here?
I didn't put that one forward, but there is a current 0.1% sales tax to fund chemical dependency and mental health that the county council passed in December of 2008, and we started collecting money in 2009, started spending money in 2010. That one sounds like maybe they were trying to reference the 2% or 0.2 or 0.3% sales tax for criminal justice or law and justice. I didn't put that forward, though, so whoever put that forward may want to clarify that.
I'm not entirely sure I remember who put this forward either. If you remember that you put it forward, let me know. Because I couldn't tell if this was, the county in Snohomish has already implemented the CJ tax or not, sales tax or not.
The criminal justice tax, no. We've done the mental health chemical dependency, 0.1%. Again, that was passed in 2008. We started collecting in 2009 and spending in 2010.
Okay, and this is a...
That's a criminal justice one.
Okay, and it's a 0.3%? I can't remember.
I think there's anywhere from a 1% to 3%. Do you remember what it is? I do know that I've been told that Snohomish County did put that on the ballot back in 2000 or something, and the voters voted it down, and it hasn't been put on the ballot since.
Okay. So this appears to be about it's helpful to clarify what that is. Okay, thank you for that. Anything else on this last list? The verbiage is pretty clear. People did a nice job in their homework, and of course I did some creative reconstruction and consolidation, but hopefully the ideas are clear. So we will be, seeing no further questions, we will be adding the subcommittee ideas you're going to hear, and then removing the duplicates as much as we can. The only people that vote on this are the primary task force members. The support staff team does not vote on this. The alternates do not vote on this. We want to get all of you, all 23 of you, to get your ballots back, and you'll have about a week, and we'll talk about that. Do we need to talk about that now? Yes, the next steps, very quickly. In your packet behind the ballot.
Yep. Is it there? From ballots to final report.
So this document here, next steps from ballots to final report, it sort of gives you the timetable in 9 easy pieces, we hope, about how we're going to get from here to our last meeting. So we'll finalize the ballot. We will send it to you next Tuesday. You will email it to me. I will forward it to the staff without attribution. They won't know whose ballot it is. They will, it is a public record if somebody gets very excited and wants to see how everybody voted. We will bring back the collated results to you and present them at meeting 7. And at that meeting 7, where I'm in step 6 there, we will identify where the consensus, 80% support or more, 60% or more. Ken?
Just one quick question. I just want to verify. I think I know the answer, but city staff and county staff, neither of those groups vote.
Correct.
Good. I don't have homework. Thank you.
You have no homework. Well, actually, there is a thought about homework. I forgot. So we will then at meeting 8, after we talk about it, meetings, all next meeting is going to be about how do the votes come out? Do you want to adjust the votes? What's the best way to sort of consolidate the recommendations into a meaningfully, easily digestible set of recommendations back to the mayor and the community? We'll talk about that. We'll also talk a little bit about expectations for implementation and follow-up, and ideas about the communication plan. Who, besides the mayor, would be interested in hearing from you about your findings? And start trying to identify those groups that would be part of a rollout for your final report. So that's all meeting 7. Meeting 8, I will bring an outline of your report. We'll go over that. At meeting 9, you'll get a final report, and we'll go over that and edit it. And then after that, hopefully you'll be able to sign off online. If there's a lot of challenges to the report that I bring back at meeting 9, we can have an additional meeting. Otherwise, we should be able to finish up the work online. So that's the path ahead. Okay? I think this would be a really great time for a break. What do you think? I think that's fair. Let's take a 10-minute break, come back, and then we'll go through the subcommittee recommendations. Thanks, everybody.